next group of tests will be for the wrist and hand. The first test we want to do is Watson's test. Watson's test, you will have the athlete seated with their elbow resting on the table, their forearm pronated, and ulnar deviated. The athletic trainer will face the athlete and put one hand over their scaphoid area and their opposite hand over the fifth metacarpal, passively ulnar deviating and extending the wrist. While the opposite thumb stabilizes the scaphoid, you're going to passively radially deviate and flex the wrist while maintaining pressure on the scaphoid. A positive test occurs when they get pain at the dorsal rim of their radius. This is going to indicate subluxation or instability of the scaphoid and possibly the lunate. This is a test that can also be used to suspect a scaphoid fracture too. The next test is the supination lift test. With the athlete seated, elbows flexed, and forearms supinated, you want to instruct the athlete to place their palms under a heavy table. Next, instruct them to lift the table or apply resistance to the table. Pain or difficulty when applying that force indicates a potential dorsal TFCC tear. The next test we want to do is called the Sharpie's test, or the TFCC load test. With the athlete seated, the athletic trainer is going to hold the athlete's forearm and also hold the athlete's hand with the other. I'm going to apply an axial load in this direction while ulnar deviating his wrist. I can also apply dorsal and palmar movement, or alternately apply pronation and supination. Pain, clicking, or crepitus near the wrist indicates injury to the TFCC. Sharpie's test. The next test we want to apply to the wrist is the AP glide test. AP glide test, you're going to stabilize the distal forearm with one hand, stabilize the carpal bones with the other, and apply an AP glide to the radius on the carpal bones. The next stress test we want to apply to not only the wrist but the fingers is the valgus and varus wrist and finger stress test. For the wrist, you'll grab the distal forearm and your carpal metacarpal area, and you're going to apply a valgus force or a varus force at the wrist. Injury to the ulnar collateral or the radial collateral ligament will implicate those with instability or pain with that stress test. As we move down to the fingers, valgus and varus stress can be applied at the PIP and the DIP joints of the fingers. The next stress test we want to apply to assess the ligamentous stability of the thumb is gamekeeper's thumb test. With the athlete seated, the athletic trainer is going to stabilize the first metacarpal as well as the PIP of the thumb. We're going to flex the carpal metacarpal joint to 30 degrees and apply a valgus force in that direction. Valgus force in that direction. A positive test indicates an isolated injury to the collateral ligament, the ulnar collateral ligament of the thumb, indicating gamekeeper's thumb. If we apply put the thumb in extension and apply a valgus force, this not only stresses the collateral but also stresses the accessory ligaments as well. Gamekeeper's thumb. Our next test is Finkelstein's test. With the athlete seated or standing, you're going to instruct the athlete to make a fist and tuck their thumb inside their fingers. The athletic trainer is going to stabilize the forearm and passively deviate the wrist toward the forearm. Pain over the abductor pollicis longus or extensor pollicis brevis tendons indicates the Quervain's disease or tenosynovitis of these tendons. Keep in mind this test creates many false positives. Our next test is Phelan's test. Phelan's test, we're going to have the athlete seated or standing, and we're going to ask the athlete to passively push or flex the wrists together and hold that position for 1 minute. Tingling in the thumb, index, middle, or lateral half of the ring finger indicates carpal tunnel syndrome or compression of the median nerve. An alternate test to the phalanx is the reverse phalanx for the person who can't do it, in which they'll get in a prayer position in the same position, holding it for 1 minute. 1, 2, 3. Our next special test is Tinel's sign, specifically at the wrist. With the athlete seated, the elbow flexed to 90, and the wrist supinated, we're going to tap the carpal tunnel at the wrist. A positive test indicates tingling, paresthesia into the thumb, index finger, middle or lateral half of the ring finger. That's going to implicate carpal tunnel syndrome. The next test is the pinch test, or Frohman sign. With the athlete seated or standing, the athlete's going to attempt to grasp paper between the thumb and index finger. Grasp. The athletic trainer is going to attempt to pull it away. A positive test occurs when the terminal phalanx of the thumb flexes. This indicates paralysis of the adductor pollicis muscle and potentially involves the ulnar nerve paralysis. Alternate to this is Jean's sign. Jean's sign occurs when the MCP joint of the thumb hyperextends while trying to hold on to the paper. Ready, set, go. Our next test we want to do is the Allen's test. With the athlete seated, you're going to ask the athlete to open and close the hands several times and hold a fist. You're going to compress the radial artery and the ulnar artery, releasing one artery at a time, watching the filling pattern of the artery to determine which is the major blood supplier to the hand. Set, go. To sum up our special tests, I'd like to discuss the sensory distribution of the hand. The ulnar nerve sensory distribution is to the dorsal and palmar side of the fifth and half of the fourth finger and includes the hypothenar eminence down into the wrist. The radial nerve is the dorsal side of the wrist, hand, thumb, first, second, and half of the third metacarpal, all the way up to the PIP or DIP of the fingers. Lastly, the median nerve is the palmar surface of the half of the thumb, index finger, middle finger, and half of the third finger, and on the dorsal side at the DIP of the index, middle, and half of the third finger.